How would you describe what we're currently seeing with COVID in the state and in southern Nevada?
We're still seeing spread of COVID in the community. The levels are very low compared to where they were earlier this year. When we saw the Omicron surge that hit, the numbers were very high. We're at a fraction of that, just a couple of % of where we were, but we're still seeing transmission, and those numbers have gone up a little bit over time.
So what's on the horizon for us based on what we're seeing in the rest of the country?
It's really difficult to predict far out what's going to happen next. We can talk about the recent events, we can talk about what will happen over the next few weeks, but trying to predict, is this something that we're going to see every fall? Is this going to be a winter disease, something like that? We don't know. What we can say is there's been an increase of disease here and throughout the country. We will see surges in different places at different times based on those communities. But those surges probably are not going to be anywhere as big as the Omicron surge because so many people got sick that there's a lot of immunity in the population right now. So we did such a bad job stopping Omicron earlier, it gave us a lot of protection right now. It's kind of like stopping a forest fire by letting the forest burn to the ground. The forest fire is stopped, not that we wanted to take that route to it, but it's the point now where there isn't there isn't a big susceptible population in southern Nevada right now.
What is the role of immunity with this new subvariant?
Well, the subvariant still seems to respond to the vaccine, and previous infections give us protection against any of these new subvariants. We haven't seen one yet that is so different that our immune history throughout the world is irrelevant. So right now we are still seeing protection from the vaccine and from natural infection, but even if it's the exact same strain, with coronaviruses, immunity wears off pretty quickly. That's why you get the common cold over and over in your life, because immunity doesn't last a long time.
And if we are able to somewhat predict what's coming in the next few weeks, what is your level of concern?
I think if we saw a big jump, we'd be a lot more concerned. We've seen just a slow, steady increase. We know that there's transmission in the community. There's still that potential to get sick. If you're at crowded events around a lot of other people, we can still have these bigger super spreader events. We still hear about those happening all over the country from time to time. Right now, though, it's just something that we have to deal with. It's kind of that background disease that's there. So we have to have a healthy respect for it still. It still could flare up, but it's not like we're in the middle of one of those bad waves that we've previously had.
What's driving this increase?
Well, it's a combination of things. It comes down to the immune history of our population. So what % of people have been naturally infected, what % are vaccinated, what's basically going on with all of our immune systems, and then it's our behaviors. If we spend more time together in close contact, there's a higher risk. If we spread out more, there's lower risk. And so everything that we do affects the risk of disease transmission. Every event we have adds some additional risk to disease transmission in southern Nevada, and that's what drives in the community. There isn't one simple answer. It's basically the total of all our behaviors.
There's a sentiment that the pandemic is mostly over. What do you think about that?
Well, I think we're moving on to another phase of the pandemic. This is not a disease that's going to go away. It's not something we're going to eradicate. So COVID is going to be with us all for the rest of our lives. It's not just going to disappear. But we're not seeing a lot of disease transmission like we saw in the early waves because we have immunity in our population. Once you reach higher levels of immunity, that starts to get things under control. We see flare-ups from time to time, just like we do with influenza. Flu shows up every single year. Everybody doesn't get flu, though. We have a vaccine that protects us, but we have pretty bad vaccination rates nationwide and in Nevada. And so all those things together cause an increase in disease, but not one that completely overwhelms the population every year. And that's probably where we're headed with COVID.
There's research from Brown University that Nevada is among the top 10 states for COVID deaths that could have been prevented by vaccines. What do you think about that?
Nevada has historically not done very well when it comes to vaccination. We're usually near the bottom of the list for childhood immunizations, unfortunately. When flu season shows up, we get about 50% of our population vaccinated for flu. The rates are better in the older population that are higher risk for serious disease, and it's worse in a younger population that's otherwise healthy. We're seeing the exact same thing with COVID. So it's unfortunate, but it's also not a surprise. It really matches what we do normally with vaccination. COVID really isn't anything special. It's just the way Nevada approaches public health. And we've struggled to get the right people vaccinated to prevent disease from occurring and ultimately prevent deaths.